Hi everyone, I'm Dr. Vrinda Agarwal. I'm an endocrinologist at Care Hospitals, Banjara Hills in Hyderabad. So today we're going to talk about skin conditions that may be associated with diabetes. So diabetes can virtually affect any part of the body. More commonly, we hear of development of heart disease, stroke, kidney problems, loss of eyesight. But skin is an equally important organ that diabetes can affect. So oftentimes, patients will present to us with the concern for recurrent skin infections or boils or blisters, and that's how we diagnose diabetes. So in a way, patients with diabetes are at a much higher risk of catching infections, which could include bacterial infections, fungal infections. These infections could be localized, to the skin, could involve the hair follicles. We see boils and blisters. So there are some skin conditions which are just basically secondary to just having a higher predisposition to catching these bacterial or fungal infections. And then there are certain skin conditions which are specifically associated with diabetes. So like, for example, there is something called as diabetic dermopathy. So that is a specific skin rash that can be identified by your doctor, and that is specifically seen in patients with diabetes. Then there is something called as acanthosis nigricans, where patients tend to demonstrate velvety dark rash around their neck, around their knuckles, and that is a sign of insulin resistance. Which means that your body is not as sensitive in responding to insulin. Thereby, it's a marker of insulin resistance, and the risk of diabetes is higher. Then there are certain other conditions which are specific to the patients with diabetes. We also see xanthelasma, which are basically yellowish blisters which can be seen sometimes around the eye, which is secondary to an increased predisposition to high cholesterol in patients with diabetes. So while we talk about all these skin conditions, the most important take-home point is that we need to take care of our skin. Especially if we have a diagnosis of diabetes. So we should try and prevent dry skin for the most part. So especially in like winter weather, we should try and avoid or minimize the duration of the baths. We should always make sure that our skin is moisturized. We should especially take care of our feet. So feet is I believe that one of the most neglected parts of our body. So how I recommend is that for all patients with diabetes, they should at least make sure they check their feet before going to bed. If there are minor cuts or blisters, then we should immediately take care of them by applying a band-aid or an antiseptic ointment. We should try to prevent skin dryness, which leads to increased itching as well. So it's very, very important to stress the importance of good skin care in patients with diabetes. Thank you.